Hi, my name is Mark Silver, and we're continuing the videos based on my book, Borderline Personality Disorder, Survival Guide from Chaos to Authenticity. The previous videos that I did were an introduction, an explanation about clinical evaluations, and then we looked at the criteria of BPD as found in the DSM-5. The next several videos are going to be based on a much more systemic understanding about the criteria of borderline personality disorder, given the clinical presentation that we see and the issues that actually come up, which I think are extremely important, but not necessarily included in the DSM-5. Almost everything exists on a spectrum, and this is especially true for healthcare issues. Borderline personality disorder exists as a general category with people experiencing most, if not all, of the symptoms at one time or another. But more often than not, people experience the symptoms with a wide range of severity, and for several months, a person may experience only a few of the symptoms in a milder form or perhaps not at all. The next videos that we're going to be presenting will identify major issues in BPD that are omitted from the DSM-5 criteria. The criteria that I'm presenting here are both the outgrowth or consequences of criteria noted in the previous videos that I've done, but also distinct criteria in their own right that require serious consideration. A symptom should reflect any behavior, cognitive, or emotional issue that helps better identify a larger pattern within a syndrome or disorder, leading to a clearer and more accurate diagnostic picture. It is hoped that the symptoms or criteria noted here will add greater clarity and exactness to an understanding of borderline personality disorder. So the first criteria that I'm adding here is cognitive dysregulation. Then we'll be looking at behavioral dysregulation. Cognitive dysregulation generally concerns difficulty processing information, learning or retaining new information, confusion, poor focus, and memory loss or dysfunction. Memory is how the brain unconsciously encodes or metabolizes or processes and retains information for future decisions and judgment about behavior, emotion, and thinking. Memory is critical for self-reflection, allowing to build an identity through time and experience. In general, human memory is quite fallible, and a core characteristic of trauma is that it may imprint a memory that cannot be forgotten. Trauma is something that cannot be unseen or unfelt, and post-traumatic stress disorder is the pathology of forgetting. We generally forget, or we do not remember, the vast majority of information that we perceive, and yet we sometimes encounter situations where a memory is unforgettable, often to our detriment. For borderlines, cognitive dysregulation may also include impressionistic perception, leading to imprecision or exaggeration or distortion of meaning and difficulty discerning nuance. Borderlines may also have difficulty in inferring someone else's thoughts or intentions, leaving them feeling socially awkward. Some borderlines are so preoccupied with certain negativistic or morbid ideas that they essentially become obsessional thoughts that swirl around like an eddy, prohibiting proper focus on those things that are truly important in the person's life. In general, humans are error-prone due to assumptions, biases, and prejudices, and this is certainly true for borderlines due to cognitive dysregulation. Ultimately, cognitive dysregulation may limit the borderline's ability to fully and accurately understand himself and others, think through problems, and it may result in poor judgment and rash decisions, leaving the borderline feeling foolish, scattered-brained, ignorant, or socially awkward. The most serious consequence of cognitive dysregulation is that it causes disorganization in daily life, prohibiting the borderline from strategic planning, problem solving, and adaptation, which are key to personal development and success. Destiny is comprised of careful planning, but also random chance. The motto, "the harder I work, the luckier I get," sounds smart, but hard work requires cognitive skill and organization, and people who suffer from cognitive dysfunction and disorganization cannot make their own luck and therefore cannot assume control of their lives, and they lose a sense of agency and autonomy. If you can't strategize, then you can't organize, plan, or problem solve because you can't juggle ideas even when the issue is immediate and serious. And the inability to strategically plan due to cognitive dysregulation can completely undermine the borderline's life, leading to behavioral dysregulation, which is what we're going to talk about now. Cognitive and behavioral dysregulation complement and reinforce one another, magnifying the negative effects of each. Poor or limited physical functioning is most often the result of neurocognitive or neuromuscular degeneration due to a genetic disorder, disease, aging, and even various viruses and bacteria. Most people, when they set their mind to something, can undertake short-term tasks with relative ease, and although long-term projects may require greater effort, with proper planning, these goals can also be met. Yet some borderlines don't really get through the day at all and essentially do not function, living their lives without a career, interests, or personal development, unable to attain either short-term or long-term goals, causing chronic feelings of frustration, anxiety, and even profound personal disappointment, believing that the individual is a failure. Someone who suffered horrific abuses in her childhood once told me, "I just suck at life." This was a woman who could provide insightful input when discussing various psychological issues, and yet she just could not get her life together in a meaningful way. That is, she could not progress from step to step or accomplish much of anything other than holding a menial labor job. Paradoxically, because of behavioral and cognitive dysregulation, some borderlines actually become obsessive about having a controlled and orderly life, perhaps because the borderline feels that anything less will cause his world to fall apart. One way that borderlines gain control is by limiting or monitoring the kind and amount of food they eat or reject, which may lead to an eating disorder. This is especially serious when the borderline's erratic eating patterns are reinforced due to depression and anxiety, which may also draw attention to the borderline's internal pain. For some, anorexia is not a desire to be thin, but a desire to look ill or to engage in self-punishment. Behavioral dysregulation or dysfunction clearly has a planning and a strategic component, but without self-knowledge and self-love, healthy progress can only be incremental at best. When both cognitive and behavioral dysregulation are present, so is psychic pain, and that will be what we will look at in the next video.